Assalamu alaikum wa rahmatullahi wa barakatuh. I'd like to thank our moderator, Dr. Arozullah, and thank you for coming and attending, and it's a pleasure to be here. I'd like to just start off by acknowledging a few people that were responsible for making this presentation possible, and I apologize for not having any slides to share with you, but I do have some information that I'd like to pass on if you're interested, especially around this topic. I am not only passionate about this topic after having done a little bit of research about the background and the issues surrounding the particular topic, but having two children of my own and having gone through the very early stages of their life where vaccinations are a huge part and parcel of their medical care, it's something that comes as a personal objective of mine. So I'd like to also thank Sheikh Omar Qureshi. This is not the Sheikh Omar Qureshi who will be presenting here today. He is not here at this particular conference. He was here 2 weeks ago for the AMJA conference in Chicago. He is a faculty professor and instructor at the Institute of Knowledge in Diamond Bar, California, which I'm also affiliated with. Sheikh Omar was a huge support system in figuring out the navigation through the Islamic topics within this particular subject. He's a graduate of Azhar University in addition to studying in Syria and in other places. He has taken on, inshallah, a role to study with Dr. Sherman Jackson at the University of Southern California in his PhD program. Inshallah, he'll be embarking on that soon. So I'd like to thank Sheikh Omar. And last but not least, I'd like to thank my brother, Azeem Syed. He's back there, the Director of Community Relations with Ummah Clinic. He was also very instrumental in facilitating everything here. And so, again, I just wanted to make some general points about the concept of moral relativity and requiring vaccinations in school children. I've revised the title somewhat, so you will notice in your abstracts within your program booklet, the word public has been removed. It's school children in particular. And the impetus for this and the reason why to even look at this has come about because of a result of a law passed in January of this year, 2016, where the California Senate passed a Senate Bill 277 that requires now any school-aged child that will be attending school in a classroom setting, that includes both public school and private school. So it excludes anybody in a homeschool setting or anybody in an independent study program. So if you're around children in any sort of setting, you have now no exemption to opt out for personal belief excuse, what was called a PBE, a personal belief exemption. That would be something that you could in the past have as a result of your personal convictions for whatever reason, religious, even medical, obviously. So now 10 vaccinations are going to be the prerequisite for sitting in a classroom setting in California. Now, there has been, obviously, with any medical or scientific injunction, especially on a legislative level, there has been a lot of talk and a lot of discussion about the reasons for this, why it came about, should it still apply for all the school children that it applies to. Before I go any further, there is an exemption that can be signed off, still applies. That is a medical excuse in a letter form that has to be signed off. That used to be signed off by allied health professionals of all types, but now the only exemption for this rule for Senate bill, which is abbreviated SB 277, is a letter signed off by only a practicing physician, an MD or a doctor of osteopathic medicine, a DO, declaring that the only possibility to have an exemption from the vaccine rule is somebody who is going to be more harmed by the vaccine than benefited. So I'll just repeat that. Somebody who has the potential to be more in danger after receiving the vaccine than not having received it. This has to be signed off, obviously, after a consultation, and this is the only excuse that a physician of a practicing perspective can provide for any school-going child. So to backtrack, This has caused, again, awareness, concern. We actually had in Southern California a debate that was already set to happen. It was a moderated debate in the Islamic Center that is pretty influential in the area. And we had the flyer set up. And just to show you how much thought has gone into this, and just to also give you a glimpse into how passionate people are about these topics, everything was set. We had presenters on both sides. I was going to help moderate on a panel of people that were going to bring the discussion back onto the points that were going to be needed to be discussed. But what had happened was we had a medical malpractice lawyer on one side, and we had a practicing pediatrician on the other side. And unfortunately, the two sides couldn't see very closely on what the objectives of the debate were. So one, unfortunately, had, just because of the background that she came from, had a different agenda, and the practicing pediatrician just wanted to give the community, and this is what it's all about. It's not about the people that did the research. It's not about the people that wrote the laws even, as much as it is about the children in the community, whether they're Muslim, non-Muslim, getting their best care that they need, and to ensure the general safety and well-being of those around them. So he wanted to present a perspective to the Muslim community that these are your options, these are the risks, these are the benefits, and you have an informed decision to make when you're given those options. But unfortunately, just because the discussion got very heated, even before it even started, so there were some email exchanges that got a little too personal, I can say, of some nature, the debate was called off. But just to show you that this is a hotly contested topic, now I know people have a lot of anecdotal and personal experience, and they may present this as sometimes their own reasons to do and think what they venture to think about this particular topic. But regardless, I want to take a step back and look at the connection between what this law intends to achieve. And this is just like many laws out there. They are there for a certain reason. We talked about this yesterday very nicely about getting to the objectives of why certain laws exist. Why we are supposed to be good, and what the reasons and final conclusions that we tend to achieve from being good. So, historically, the case for vaccinations, I'm sure we know, has been demonstrated throughout history. Anyone venture to guess when the first documented inoculations, or what's called variolation of vaccines, started? I mean, we're talking about primitive forms, not nearly as advanced and complex and sometimes tricky as it is today. But how far do you think vaccines go back? You can throw just a number out. What's that, Dr. Matson? You were brave enough to speak, so I'll call on you. 14th century. The Chinese actually were reported to have some practices around taking off scabs from infected patients and treating each other from 1,000 common era. So, but it most popularly became a practice that was brought back to Europe. Actually, Sheikh Hamza Yusuf has a talk where he talks about the fact that Muslims have this also in their heritage. Lady Montagu went to the Turkish baths from having been in England, and brought this idea where she saw people that were not getting infected while they were around other infected people. She brought this practice back in the 17th century to England, and this was a little bit even before Edward Jenner and the smallpox vaccine. So the point is, it's an age-old tradition. We're talking about not centuries, but in this case, millennia. Now, how it's evolved is another question that's outside the scope of this paper. What I'm particularly referring to is the fact that it's a proven method of preventing disease. And not only is this a consideration in the United States, henceforth the law being passed in California, but this was a topic of debate 2 years ago. The International Peace Corps has a wonderful website about what's called the Dakar Declaration. That's spelled D-A-K-A-R. And Sheikh Abdullah bin Bayya, Sheikh Hamza Yusuf, and some other scientists, epidemiologists were also present in asserting that global vaccination and the awareness to get children, especially vaccines that they need, is a world concern. They put out a wonderful Dakar Declaration from the meeting that took place in Senegal. And they also emphasize the same point, that vaccines have saved millions of lives, prevented costs of doctor visits, hospitalizations, and premature deaths. And they actually pointed out a very relevant detractor from this discussion, and they said I'm just paraphrasing, they stressed that the resistance to the idea of vaccination, we're not talking about resistance to vaccines themselves, but just people having a thing to say against vaccines is usually things that stems from, and I'm quoting them, rumors, uncertainty, and inadequacy of understanding. And that's the paper that they published called Vaccinations and Religious Issues, which is also entitled, for shorter purpose, the Dakar Declaration. So again, now that we've established that it's an age-old practice, it is beneficial, whether in the United States or across the world, how do we rationalize this decision-making process? Why are some children going to receive the vaccine? What is the reasoning behind that? How is everyone else affected? And these are the same principles, and this is what the paper set out to accomplish, was how does the thought process of the legislators in the California Senate, how does their thought process mirror, or how does their thought process parallel the thinking of the Islamic jurists when they came up with what's called the qawa'id fiqhiyya, the rules of Islamic fiqh, not only the tools, but their principles and their maxims that they've put forth for gaining public welfare. And before I exactly pinpoint those maxims, I would like to talk about the fact that, and Sheikh Omar confirmed this for me, that the approach of extracting application and the practical considerations from a law does not only limit itself to man-made laws. So you can actually approach a scriptural text and derive laws from that and derive the reasoning from that, but you can also do that in a man-made context. So if there's a law that people have put forth, this particular portion of legislation can also be looked at in the same ways and applied some of the same principles, obviously for different reasons and different objectives. And Asif al-Qureshi Landes is a lawyer by profession and trained in constitutional law, and she's written actually a whole paper about how the U.S. exactly in the same way that the Quran can be looked at. It's a wonderful paper about how this seems like two different tracks, but they're actually following the same path. And she comparison about how the late Justice Antonin Scalia, who just passed away, how he is an originalist and sticks to the letter of the law, or what the intent was for the people who wrote the law and why they wrote it. She compares his school of originalism in the U.S. Constitution to the originalism that she defines in her paper from the Maliki school of thought about the practice of the a'mal of the people of Medina, why it was done. She compares that and just makes a comparison. So the qawaid fiqhiyya basically come down to dar'ul mafasid wa jalbul masalih, that you are going to be extracting the maximal benefit and repelling the harm as much as it applies to stopping all modes of the spread of disease. And this is what's called saddul dhara'i', because you're closing off the doors to harm. And this is exactly why we have the concept of what's called in the scientific community the concept of herd community. A portion of the population has to be vaccinated for the vulnerable in the population, the children that are already sick and can't receive vaccines, for them to be protected from it. And this stemmed also from a recent outbreak you might have heard in Disneyland at the end of 2014, the early part of 2015, there was an outbreak of measles. And this brought about not only an awareness, but people started to need the pressure to make decisions about whether they should get vaccinated, why not, why is this happening. And the paper then goes into the fact that the legal maxim covered by this is a specific harm, and I'll just say the English part here, a specific harm is tolerated in order to prevent a more general one. That ad-darar al-khas is the hamal of that is more tolerated to prevent a more ad-darar al-am, that a more general pending problem is prevented by a certain individual getting vaccinated. And this is, again, a discussion of what's unconditional, mutlaq and muqayyad, what is conditional. And the paper, again, if you're interested, and I'd like to, again, sit down and have a discussion with you about, the last thing I'd like to make is a parallel between the excuse provided for patients. So if you do have a medical reason for not receiving the vaccine, this, again, discussion goes back to something that Ashurun is a 11th century famous Islamic jurist from the Hanafi school of thought. He put forward 3 reasons why people don't have to stick to particular forms of worship in the ways that are required. And they would say the same thing, that it has to be a clear and obvious sign of sickness, a past experience, and a medical opinion from a skilled physician. Again, this, I'm quoting him. This would be the same reasons, clear and obvious signs of a patient not needing, or a child not needing to receive the vaccine, a past experience of allergic reactions possibly, and again, a medical opinion from a skilled physician. So there's a lot of reasons behind this law that mirror Islamic thought, and it's up to us to understand the greater purpose of these laws, and especially how we can apply Islamic principles if needed. And this will bring us to a more complete understanding of the needs and the wants and the specific reasoning behind these laws. Thank you for your attention.